Everyone, welcome to another video. So in today's video, we'll be talking about piles or hemorrhoids. So piles are medically known as hemorrhoids, and they are swollen vascular cushions in the anal canal. So while they are part of the normal anatomy, aiding continence and helping with bowel movement and control, they become problematic when they are swollen, prolapsed, or thrombosed, and they are classified either as internal, that is when they are above the dentate line and when they are not painful, or external when they are below the dentate line and when they are painful. So the anal canal contains three major vascular cushions. There's the left lateral, there's the right anterior, and then there's the right posterior. So these cushions, they assist in maintaining continence. Supportive tissue degrade due to aging, pressure, or straining, and this can cause them to enlarge and prolapse. So in internal hemorrhoids, they are covered by columnar epithelium, which is um, insensitive to pain, while external hemorrhoids, they are covered by squamous epithelium, which are pain sensitive. So that is why when someone has internal hemorrhoids, it usually comes without pain. The external hemorrhoids comes with pain. So for the causes and the risk factors, chronic constipation or diarrhea, straining during bowel movements, pregnancy, obesity, low fiber diet, sedentary lifestyle, prolonged sitting in the toilet, aging, portal hypertension. Then for the symptoms, so for internal hemorrhoids, we have bright red painless bleeding, then prolapse during defecation, then mucus discharge, then having a feeling of incomplete evacuation. Then for external hemorrhoids, there's anal pain, especially during defecation, there's swelling or lump at the anus, then there's thrombosis causing severe pain and bluish discoloration. So diagnosis is usually done by having a physical exam to inspect and do a digital rectal exam. Then there's something called anoscopy, which is for the internal hemorrhoid visualization. Then colonoscopy is also done for patients over 40 or those with rectal bleeding to rule out other serious conditions like, for example, colorectal cancer. So for the treatment, we have conservative management procedures like these conservative management procedures are usually first line. So they include having trying to include high fiber diets in your food like vegetables, fruits, and having increased fluid intake like 2 to 3 liters per day. And so um taking stool softeners like lactulose if you have constipation that is accompanied with your hemorrhoids. Then topical agents when it comes to medications like topical agents like ointments, suppositories that contain local anesthetics, corticosteroids, or astringents like lidocaine, for example. Then oral flavonoids like diosmin, hesperidine, they can help to reduce inflammation. Then there's something called seas bath, which help to also reduce the pain and the inflammation. Then we have minimally invasive procedures too can be done, and these minimally invasive procedures they usually come about when the conservative management procedures have failed or they are not working for the person. So, for example, there's rubber band ligation, there's infrared coagulation. So these are procedures that are done when conservative management procedures are not sufficient. Then also surgical options are there too, depending on the grade of the hemorrhoids, because usually surgical options are done when someone has a grade 4 internal hemorrhoid. So internal hemorrhoids have 4 grades. There's grade 1, grade 2, grade 3, grade 4. So that's minimally invasive is usually done for when somebody has like grade 2 and grade 3 hemorrhoids, or when the conservative methods are not working. So in summary, these piles, they are swollen vascular cushions in the anal canal, classified as internal or external. Internal is painless, external is painful, and they are caused by increased intra-abdominal pressure, straining, or weakened connective tissue. And symptoms include rectal bleeding, prolapse, pain, swelling, and diagnosis is usually clinical based on physical examination, supported by endoscopy anoscopy if it is needed. And treatment usually ranges from dietary changes like increasing your fiber diet, taking more fluids, and medications like local anesthetics, corticosteroids, oral flavonoids to help with inflammation and all that. And then there could be the minimally invasive procedures like rubber band ligation in advanced cases. So that is it for this topic, and I hope you learned something from this video, because I too also recently learned about hemorrhoid. So because it's not something that is usually talked about as like so often, because most people are usually embarrassed to talk about it, or they just feel like it's a self-limiting kind of condition. So if you know anyone that is currently going through this, or if you are also if you are the person going through this, so it's good to just speak up so you can get the treatments that you need to solve your problem. So thank you for watching. I'll see you in the next video.